Here at Curtis Orthodontics, we love video. It's a way to educate our patients about the process. The more our patients know about the process, the less scary it can become for kids and parents. We're going to be talking today about foods to avoid, how to activate your expander, and how the process works. While wearing your expander, you're going to need to avoid sticky, chewy foods. Those sticky, chewy foods can pull your expander off when chewing. The types of foods that are sticky and chewy are Jolly Ranchers, Now and Laters, Gobstoppers, things that are really hard and sticky. You're going to want to avoid those things. During the process of wearing your expander, you'll also get a little bit of food caught in there. The best way to get food out from inside your expander is with a toothbrush, brushing the roof of your mouth. So the first most important thing you need to learn how to do is activate the expander. We're going to be using a key to insert into the appliance to activate it. When we activate it, we complete a turn that delivers force to the jawbone. That force is lateral from side to side. As we do that over the course of about 2 weeks, you're going to see a space form between the front teeth. Don't worry, that's normal. During the time that you're going to be wearing your expander and it's being activated, it's normal to feel pressure on your teeth, your jaw bones, and even up to your nose. When you activate the appliance, you'll be given a key. This key inserts into a small hole in the middle of the expander. When you place the key into the hole, you'll insert it. Sometimes it needs to be jiggled like a key in your front door. Once it drops into place, you will gently push the key towards the back of the mouth. You'll know you've done this because you've created a check mark. Once you've pushed the expander key all the way to the back of the mouth, the most important thing is to remove it correctly. We'll ask you to drop the expander key down towards the floor of the mouth where the tongue is and towards the throat. That will keep it in that check mark form. If you've done it improperly, when you pull it out, the key will have reversed the turns and it'll be hard for you to get the key in the second time. So make sure you turn the key fully and then drop it down towards the tongue and towards the throat. Typically we have you turn your expander twice a day for 2 weeks. To make this process a little easier, we've developed this calendar. This calendar isn't something you're going to be turning into us. It's typically something that we have parents put on their refrigerator just so they can keep track of the number of turns. If we have you turn it twice a day for 2 weeks, that comes out to 28 turns. 1 turn in the morning, 1 turn at night. Even as an orthodontist, when I did an expander on my own kids, sometimes it was hard to keep track. So this calendar is a very useful tool. Putting a little hash mark every time you turn the expander will help you keep track of the 28 turns. When you come back and see us, we may ask you to turn a few more turns just to create the last bit of expansion that we want, or we may be done and high-five you. After activating the appliance for 2 to 3 weeks, we're going to leave the appliance in for an additional 4 to 6 months. That will allow the bone to remodel in the new position. At the end of that period of time, we'll either be continuing on with braces or removing the appliance and getting you fitted for a retainer. That retainer will be worn to bed at night as we wait for the rest of the baby teeth to fall out. The first day you get your expander, the expander might cause your speech to change. We invite you to say things like the Pledge of Allegiance, recite your favorite poem. That will help get your speech back to normal. Understand that the day your expander comes out is going to be just as strange as the day we put it in. You're going to get used to it. Well, that about wraps it up. To recap, we have talked about foods to avoid, how to turn your expander, and what happens after you get your expander. If you have additional questions, feel free to call our office. We're always here to help you.